Alright, so let's get started. We're going to review the medial collateral ligament today. Medial collateral ligament, frequently known as the MCL. Alright, so let's draw our bony anatomy. Alright, so we've got our femur, we've got our tibia, we've got our fibula, we have our patella. Alright, so the medial collateral ligament, as the name alludes to, it is medial, so it's on the inside of the knee. Its attachment points are the medial femoral condyle, and the ligament runs to the medial tibial condyle. So the ligament is medial and runs from the medial femoral condyle to the medial tibial condyle. Judging by the location on the inside part of the knee, you can guess that its function is going to keep the medial femoral condyle and the medial tibial condyle from being separated. So how would that happen? So injury force for medial collateral ligament injury or sprain, in many cases, most frequent cases, is a direct blow to the outside of the knee, what we call a valgus load or a valgus stress. So mechanism of injury for the MCL is a valgus blow or stress. Alright, so what does that look like? Well, you get hit on the outside of the knee, it brings the lateral aspect of the knee closer together, so the lateral femoral condyle and the lateral tibial plateau closer together, and that separates the medial side of the knee, stretching that medial collateral ligament. And what does it look like? So imagine your knee going in, what we will call knock-kneed, and your lower leg going in an outward direction. So the function of the medial collateral ligament is it prevents the tibia from going outward. So how do you test the medial collateral ligament? Well, essentially with any ligament you want to create the force that caused it. So we're going to do a valgus stress test. And that is when you, as the examiner, place one hand at the ankle and you pull outward, while at the same time with the other hand you're pressing inward on the outside of the knee, creating the valgus stress. And if the knee is injured, you will either elicit pain or you will separate that attachment point on the medial femoral condyle from the attachment point on the medial tibial condyle, and it'll do what we call open up. Now, there are generally considered three different grades of injury. So you have a grade 1, 2, or 3 sprain, or some consider mild, moderate, or severe. And you can look at that different ways. So you can look at it in terms of what is the injury that has happened to the fibers of the ligament themselves. So with each incremental increase in severity, there are more fibers of the ligament torn. Or number two, you can look at it in terms of the dysfunction that it's causing the patient. Or the third criteria or way to look at it is from a clinical exam standpoint. How much can you get that knee to open up medially with your valgus stress test? So irregardless, if you have to pick a ligament to injure in the knee, the medial collateral ligament is not such a bad one. And the reason for that is because the vast majority of MCL injuries heal conservatively. So what is the treatment if you have MCL injury? So one, initially, is the RICE protocol, rest, ice, elevation. Two, you want to protect it. So a hinge knee brace, protect in a hinge knee brace. Now, less severe injuries need less of a stout knee brace. More severe injuries need a more stout knee brace. But protect with a hinge knee brace nonetheless. 3, which is very important, is you want physical therapy to help with initial swelling and pain control measures, keep range of motion, and prevent strength loss. And you want non-opioid pain control. So you have a patient that has injured his or her MCL. How long does it take to get better? Depends on the severity, but in general terms, it can take anywhere from 1 to 3 months for healing. And that concludes the basics of the medial femoral condyle. The medial collateral ligament. The basic anatomy, its injuries, its grading scale, how you test it, and expected recovery. Hope you guys enjoyed this, and that concludes our medial collateral ligament segment.